time for some questions and answers. I had to put my glasses on. I apologize about the glare because otherwise I won't be able to see the screen. I have one question here. Can you share other stigmas that you see in your work that you'd like to conquer? I love that question. There, unfortunately, are far too many. I would say starting with substance use is one. People don't talk about substance use in addition to mental illness. They don't talk about substance use and the fact that people can recover and do recover every day. So there's a lot of stigma there, but there's also a stigma around basic things that we interact or that we see every day around poverty, around homelessness itself. Many of the people we work with, if you pass them on the street, you wouldn't guess or know that they're experiencing homelessness, and they're so afraid to even share that because the fear of so much judgment. So that is one that we see all the time. I really appreciate that question. Another question I have was someone asked, what are some of the ways that you want to do big investments? We mentioned that with the federal dollars coming down. Some of the things that we are thinking about and having bigger, bolder investments in ending homelessness are, how do we partner with developers potentially on hotel conversions, converting hotels into deeply affordable housing for people experiencing homelessness. Other things are, how do we have some of the federal vouchers that are coming down the pipeline dedicated and set aside for people with serious mental illness specifically, so that we can expand our housing first team. So those are a few of those ways. Also expanding some of our special population focuses, for example, returning citizens who are very much underrepresented in this work in housing. Every person we work with who's returning from incarceration names, housing instability as one of the primary things that they're facing. So those are some of the ways that we're looking to expand. And finally, employment services. In order for us in homelessness, there are many paths, and for many people, employment is the way out of homelessness. And so looking at how we can expand and grow our employment services is another focus for moving forward. Okay, it says, you have such a dedicated frontline staff. How are they doing through all this? And what are staff doing for self-care? We have some staff on here, but so I hope I can answer well for them. And the answers really are so many different things. I think that the flexibility in working with staff to say, if they're able to flex schedules, if they're able to, work from home. Most of our staff, though, are unable to do that because they are doing the direct frontline work. So we're really encouraging staff and managers to take the time to work together. How do they as teams, spend time with self-care, whether it's meditating, taking time set aside to not talk just about work, but about themselves and their lives. We're very gracious, as we all should be, on seeing kids and pets and homes and really normalizing the humanness in all of this work. So we also have brought facilitated some professionals in to do self-care sessions. The Went Center was fantastic and did work with us on trauma and in COVID, as well as some other professionals. So really encouraging people also to take time off. I said to all of you, but take time off as well. I got another question. What are your biggest challenges Pathways is facing right now? In addition to workforce challenges, it is capacity. So when I say capacity, what we're excited about with all these federal dollars coming down the pipeline is our ability to grow quickly. And I said earlier that we're very nimble. Well, what does that mean? If we're going to, which we'd like to do, expand dramatically the number of people in our Housing First programs, we need investments in our infrastructure, our HR department, purchasing more vehicles for the staff that are growing, finding more space, even though we're a lot virtual, there's a lot that we still do here. Expansion of our staff training. So really those investments in our ability to grow and grow quickly, because these are once in a lifetime opportunities for the feds. And these are also one-time investments. Most of these investments are not going to be recurring. So shame on us if we cannot grow and grow quickly while also supporting the staff to make sure that we do it in a very thoughtful way. So I would say those are our biggest challenges. It's not finding landlords, we still are finding housing. It is finding the resources to ensure that we can grow and grow quickly. Oh, I've got another one here. Thank you to the entire panel. And so my question is, Christy, what's on your wish list for pathways and think big? Oh my goodness, thinking big. Thinking big, I think a couple of things. One is really addressing health equity and the ending, health equity is a huge one, making sure that every person in the district has access to the housing and healthcare they need. So that includes thoughts around, and thinking big would be making sure there are universal access to some subsidized housing for people who are living on the edge and are needing that. For us, it's also big investments in ending systemic racism. We know that homelessness is an issue of race. And so making bold and strategic investments there around addressing the systems of care we have, and where does it intersect on race and homelessness, for example, in healthcare as well. So those big things will really have the biggest impact. At the end of the day, we know housing ends homelessness. So of course, the big picture and the big thinking is there on lots of homelessness, but we also need to make sure that if we end homelessness for every person today, how are we ensuring that people then have the wealth, the resources, the knowledge to have make sure that no future person is experiencing homelessness. So those are some of the big things that we need done, is changing that front door so that nobody is entering our system in the first place. So lots of room there for growth, and I think we are on the right track. Have Pathways clients, since I made the last one, so we can do a quick poll, but have Pathways clients been receptive to getting vaccinated? What have you done to help people who might be reluctant to get the vaccine? So lots of things: education, and having conversations one by one. I think the first phase, we have a lot of people who are interested in taking and actually have taken the vaccine. At first, it was the challenge all of us faced around getting an appointment. But now that vaccines are much more widely available, we actually, we're seeing the numbers rise. But I think it is about being respectful, and that's what the staff have done, respecting people's choices, but having one-on-one conversations. These are not big group conversations. So one by one, answering questions, providing education, working through someone's concerns and acknowledging those. And so many people who on the first day said, no, thank you, I'm too worried. Number one reason being worried, both for staff and for the people we serve, was the speed with which, or perceived speed with which, vaccines were developed. So we're seeing the numbers rise. Actually, this Saturday, tomorrow, we are having our first ever on-site vaccine clinic. That's going to be really exciting.